Arterial blood gas analysis, it's one of those absolutely critical, life-saving skills you need in medicine. But let's be real, trying to interpret those numbers when you're under pressure, that is the real test. So today, we're going to give you a super solid, step-by-step framework to analyze them quickly, right at the bedside. Okay, just picture this for a second. Your patient is in real distress. The lab report pops up on the screen, and you're just staring at this wall of numbers. What on earth do they mean? And more importantly, how do you turn that raw data into a decision that could actually save their life? And this is what you see. pH of 7.25, PaCO₂ at 70, bicarb is 32, PaO₂ sitting at 55. Right now, this might just look like a jumble of numbers. But I promise you, by the end of this explainer, you won't just see numbers. You're going to see the story they're trying to tell. Okay, so before we can interpret anything, we gotta know the rules of the game, right? These are the essential normal values. Think of them as your North Star for everything that follows. First things first, you have to know what's normal. So pH, that's the body's happy place. It's between 7.35 and 7.45. Then there's PaCO₂, that's our respiratory clue, and it should be between 35 and 45. And finally, HCO₃-, or bicarb, that's the metabolic clue, and it sits between 22 and 26. Seriously, commit these to memory. They are the anchors for everything we're about to do. And it all ties back to this one simple relationship, what I like to call the golden formula. It just shows that your body's pH is in this constant balancing act. It's like a physiological tug of war between your metabolic system, that's the bicarb, and your respiratory system, driven by carbon dioxide. So how do we make sense of all this when the pressure's on? Well, you don't guess, you use a system. We're about to walk through a super reliable 6-step algorithm that just cuts right through all the noise. And here it is. This is our roadmap. It's simple. We start with the absolute basics. Check the pH, then the CO₂, then the bicarb. After that, we figure out how the body's trying to compensate, we check their oxygen levels, and finally, we scan for any more complex, mixed-up signals. 6 easy steps to a clear diagnosis. All right, step 1 couldn't be easier. Just look at the pH. Is it below 7.35? Boom, that's acidosis. Is it above 7.45? That's alkalosis. This one number immediately tells you what the primary problem is. So once you know if it's acidosis or alkalosis, you gotta play detective and find the cause. Is the PaCO₂ off? Well, that's a respiratory issue, a problem with the lungs. Or is the HCO₃- the one that's out of whack? That points to a metabolic problem, something the kidneys are dealing with. Now, the body is incredibly smart. It always tries to fix an imbalance. We call this compensation. Now, don't get too hung up on these formulas. They're more for a deeper dive or reference. For now, just remember the big idea. When one system is out of balance, the other one tries to step up and pick up the slack. Okay, enough theory. Let's see how this method works in the real world. We're going to go back to our case study, that patient with COPD who's really struggling to breathe. So here he is, a 55-year-old man. We know he has a history of COPD, and he's come in with sudden, severe shortness of breath. The clock is ticking, and we just got his ABG results back. Okay, let's fire up our roadmap. Step 1, we look at the pH. What's his body's overall acid-base status right now? His pH is 7.25. Now remember our normal range? That is way below 7.35. So bam! We have a clear case of acidosis. Problem number 1 identified. So we know it's acidosis. Now we have to figure out why. Is it a respiratory problem or a metabolic one? Let's move to step 2 and check that PaCO₂. And there it is. His PaCO₂ is 70. That is way above the normal limit of 45. Now remember, CO₂ acts as an acid in the body. So this super high level perfectly explains the acidosis we just saw. This is a respiratory problem. Okay, so we've found our culprit, respiratory acidosis. Now for steps 3 and 4. Let's look at the bicarb, the HCO₃-, and see if his body is putting up a fight and trying to compensate. And this is where the story gets really interesting.
we can actually figure out if this is a brand new problem or something that's been going on for a while. So the patient's bicarb is 32. For a sudden acute problem, we'd expect his body to raise it to about 27. But for a chronic, long-term problem where the kidneys have had time to really kick in, we'd expect it to be, well, exactly 32. The numbers match perfectly. This tells us his body has been fighting this for a long, long time.
We're almost there. We understand the acid-base issue. But what about his shortness of breath? That's where step 5 comes in. Let's check his oxygenation status. His PaO₂ is 55. Clinically, the magic number we get really worried about is 60. Since he's below that, we can officially diagnose him with hypoxemia. Plain and simple, he is not getting enough oxygen into his blood.
So let's put it all together. What started out as this really confusing list of numbers now tells us a complete and coherent story. The final diagnosis is chronic respiratory acidosis with hypoxemia, which is perfectly consistent with a severe COPD flare-up.
All right, let's zoom out for a second and talk about the big takeaway. Because what we just did was so much more than just matching some numbers to a diagnosis. And really, this is what it all boils down to. ABG analysis isn't about cramming numbers for a test. It is a powerful, powerful tool for seeing your patient's real-time physiology right there at the bedside. It lets you understand the internal struggle they're going through and helps you make smarter, faster decisions. Those numbers told a story of a long-term battle against lung disease, a story of compensation, and finally, a system in crisis. So the question I'm going to leave you with is this: what story will your next ABG tell?